had PRP under eyes 2 months ago. I still have swelling underneath, especially when I smile. Is this normal? There were no filler injections done at the same time or since then. Wondering if it will eventually dissolve, or do I need to seek other options?
Thank you for your question. You submitted a question where you, without photos, but you're asking that, about having undergone PRP injections under your eyes about 2 months ago. And you state that there's swelling under your eyes, particularly when you're smiling. And you're concerned about what's going on and whether it can be dissolved. Well, I can certainly give you some guidance. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. The use of platelet-rich plasma in my practice is a very big part of what we do. We're very much excited about the regenerative medicine and the capabilities and benefits that we're able to achieve with platelet-rich plasma that's unique to it. We use it every day in our practice for a variety of reasons. Everything from acne scars to under-eye dark circles, for hollows, for improvement of skin quality, for scar revision. So I can certainly give you my experience, and I can ask you to maybe consider some other factors as well in terms of what's going on with the swelling. To begin with, first of all, platelet-rich plasma is a concentration of the wound healing elements of your own blood. And because it's a fluid, once it is injected under the skin, wherever it is, it gets absorbed. So there's an initial effect of volume in terms of the actual volume of the material itself, the fluid. But because it's not a filler like a hyaluronic acid filler, it doesn't create lumps. It doesn't create volume in that way long term. Once it is absorbed into the tissue, the effects of the platelet-rich plasma begin to occur. And those effects include stimulation of collagen formation, the stimulation of blood supply and blood vessels, the improvement in the health and quality of the fatty layer of the skin when it's applied to other areas outside the areas where there's very little fat, or like areas like the eyelid skin where you had it done. So when you think of fluid in the area that was treated, consider possibly whether or not there are some other issues happening simultaneously, whether you have allergies, whether you have sinus issues, because that's a very common expression of fluid around the eye area with those conditions. In addition, I would also say that the metabolic process can potentially recruit some fluid, but it is unusual for patients of mine in our practice to come back in 2 months and say they're still swollen from the platelet-rich plasma. A lot of times what we'll do is we'll simply review photos. We take a lot of pictures and we want to help people understand what their progress is by doing follow-up photos. And a lot of times people may believe that they're swollen when actually what they have is lower eyelid fat prolapse. And that is not necessarily the situation for you, but understand that lower eyelid fat prolapse, or the activity of the muscles around the eye called the orbicularis muscle, can be more of a factor than the platelet-rich plasma itself. On its own, the platelet-rich plasma is absorbed. Therefore, it can't really create a fluid pocket on its own that could last for this long length of time. The orbicularis oculi muscle tends to bunch and create maybe a swollen appearance, and a lot of times people come in because they feel like the margin of their eyelid is thickened from swelling, when actually it's just the muscle action. So I would recommend you go back to the doctor who performed the procedure, review your photos, have the doctor examine you, and look into what could potentially be responsible for what you perceive as swelling. But I don't think you have to do any intervention specifically because of the platelet-rich plasma, similar to what we do with hyaluronic acid fillers when we use an enzyme like hyaluronidase. So I hope that was helpful. I wish you the best of luck, and thank you for your question.